Your Excellencies, distinguished guests, colleagues, and friends, thank you for the opportunity to share a few thoughts from the Department of Sexual and Reproductive Health and Research at WHO, which includes the UN Special Program on Human Reproduction, HRP. Now, the single most transformative contributor to women's participation in economies over the last 30 years has been access to contraception, the ability to control fertility choices. We technically have a world in which the untapped potential of a significant proportion of the population is released. That world should be one in which the productive years hold boundless opportunities for women and men, including the option to be reproductive if and when they want, with an expectation to survive and thrive through a desired pregnancy, childbirth, and parenthood, with access to high-quality, patient-centered, promotive, preventive, and curative care. That does not seem like too much to ask of those who are the duty bearers, who have the responsibility to respect, protect, promote, and fulfill the human rights of rights holders. A woman in Sub-Saharan Africa has around a 130 times higher risk of dying from causes related to pregnancy or childbirth than a woman in Europe or North America. Coverage of antenatal care, skilled birth attendance, and postnatal care is far from reaching all women in low and middle income countries, leaving them at elevated risk of death and disability. Only 57% of women in the 15 to 49 age bracket make informed decisions on sexual relations, contraceptive use, and reproductive health care. Sexually transmissible infections, including HPV and therefore cervical cancer, remain a concern. 4.3 billion people, most of whom are women, will not be able to access at least one essential sexual and reproductive health intervention over the course of their lives. So here is my plea. Access to sexual and reproductive health services across a woman's life course is key to health and well-being. Comprehensive sexual and reproductive health means recognizing that productive years start from childhood to pre-menarche, through adolescence, reproductive years, and beyond menopause. And there are sexual and reproductive health and rights needs that cumulatively impact quality of life, health, and well-being. Our recent analysis show that at country level, key to advancing on the commitments to addressing the gaps in women's health is ensuring inclusion of sexual and reproductive health services in health benefit packages that are supported by a country's fiscal envelope and health systems capacity. A package of sexual and reproductive health services for approximately $10.6 per person annually would provide multiple health, social, and economic benefits, which include a decrease in unintended pregnancies by 68%, unsafe abortions by 72%, and maternal deaths by 62%, an increased ability of women and girls to exercise their rights, and increased participation of girls in schools and women in the labor market. We ask that you allocate budgets to prevent violence against women, ensure that essential health services for survivors of violence, be it women or children, are included in universal health coverage packages and financed. We ask that you invest in and strengthen national government's capacity for improved measurement and tracking of resource flows for women's health, including sexual and reproductive health services, paying attention to out-of-pocket payments, disaggregated by sex and its intersection with other dimensions of equity, such as race, caste, education, socioeconomic status, and so on. Invest in building the evidence base of investment cases for women's health and the social, economic, and societal benefits for both advocacy and resource mobilization. Thank you.